family of a teenager who died in a fatal meningitis outbreak in Kent say that they're beyond devastated. They have no words to express their loss. 18-year-old Juliette is one of two young people who've died after contracting the infection. In the last few hours, the UK Health Security Agency has defended its handling of the outbreak, confirming the strain as MenB. Well, Ellie Price begins our coverage.
Juliette, the 18-year-old sixth form student who died of meningitis at the weekend. Her father told the BBC the family were beyond devastated and have no words to express their loss. Her school in Faversham have also paid tribute, describing her as a much-loved member of the devastated community. These pictures, obtained by the BBC, show health professionals at the university in the immediate aftermath of the outbreak, transferring people to hospital, wearing protective clothing. Antibiotics were being offered on the same site as a precaution, but hundreds of people queued throughout the day to get them, not taking any chances.
We've been informed that we've been in contact with someone, so we're going to get the antibiotic, help to prevent it, but we're staying positive. We haven't had any symptoms or anything, and she's in hospital getting treated, so she's okay. We've had contact with her.
I've come along because we just want to, take precaution. We want the antibiotics. If I show any symptoms, I want to take the antibiotics. I want to feel safe, just to feel safe really, because everyone's quite petrified in this situation.
One of the young people who died at the weekend was a student here at the university.
Parents are very, very worried. My heart goes out to the families of those children who've died. I know the schools are working hard to reassure parents and do the right thing, make sure that children coming into school are safe, but it's a very worrying time.
Health officials are now advising anyone who visited this nightclub on the 5th, 6th and 7th of March to come forward for preventative antibiotic treatment. The club's owner told us her own staff have been affected.
We've got one member of staff is confirmed, so of the confirmed cases, one member of our team is one of them. He is in hospital, he is being treated and he's awaiting further tests to see if the treatment he's had has improved his condition. We've got two other members of staff who are currently in A&E with suspected meningitis, and we're just waiting for the update from them for their test results.
This campus community is now feeling very vulnerable. Ellie Price, BBC News, Canterbury.
Well, let's cross over to the University of Kent. Simon Jones is there for us. And Simon, well, we can see the students already queuing for those antibiotics behind you.
Yes, people started queuing here at 7:30 this morning, even though the pop-up clinic didn't open until 9 o'clock. They want to get hold of those antibiotics as a precaution. And yesterday, we've learned that 1,300 doses were handed out, largely to the student population here. Some who had been in close contact with people diagnosed with meningitis, others who were just worried about the situation and wanted to come along. There has been an important development in this story today. We've learned from the UK Health Security Agency, which is leading the response to this. They have identified the strain of meningitis that has caused this outbreak. It's meningitis B, and that is significant because people here who are students would not have been vaccinated against that, because the vaccination programme did begin for babies, but not until 2015, so they wouldn't have been covered. Another concern we've heard from people in the queue is the fact they don't think they were given information in a timely fashion. People weren't told until late on Sunday night that 2 people had died and 11 others were in hospital with meningitis. Now, the UK Health Security Agency has defended its response, insisting it acted swiftly. It said it learnt about a cluster of cases from health officials late on Saturday, and then the priority was to trace close contacts of those affected. When more cases emerged on Sunday, then it felt it needed to tell the wider community here, particularly the student population. But certainly people we've been speaking to feel that they had heard rumours before that, and they would have liked to have known before they were told officially, so they could have taken precautions themselves.
Simon, as always, thanks so much. We'll be back with you throughout the day. Simon Jones there at the University of Kent. And on some of the points that Simon was making, our health correspondent Nick Triggle has been looking into that response from the UK Health Security Agency, the UKHSA, which is the kind of government body which responds, prepares for these kind of infectious diseases. Questions over the speed of its response.
Yes, there certainly are. Now, invasive meningitis, where it causes serious illness such as blood poisoning and inflammation of the brain, is classed as an urgent notifiable disease. And that means doctors, the NHS, as soon as they suspect a case, they don't even have to have it confirmed. As soon as they suspect a case, they should alert the UK HSA. Now, the UK HSA said it was notified, and that word's important, notified of cases from Friday to Sunday, the 13 cases, 2 of whom have sadly died, they were told about. And they're adamant they acted quickly, but we understand these young people were admitted to hospital before the weekend. Talking to one person involved in managing this outbreak, they are saying, well, why wasn't the alarm raised earlier? If it was raised earlier, steps to contain, steps to offer preventative antibiotics could have been taken sooner. These are questions we're putting both to the NHS and to the UK HSA.
When you get the responses, Nick, you'll have to come back and just fill us in. But we heard there, when it comes to the vaccine, so 2015 is that cut-off point. Young people born before then are not vaccinated for meningitis B. Just talk us through the vaccine, its effectiveness, why that decision was taken to then bring it back in 2015.
Well, firstly, this strain B of meningitis, is responsible for the majority of the cases of invasive meningitis. There's around 300 to 400 cases a year, 80% of which are down to strain B. Now, as you say, the vaccine against strain B was introduced, and it was introduced for young infants, babies, because their immune system is still developing. But the problem is, strain B is essentially, there's a lot of variation in strain B, it's essentially a collection of different strains. So that vaccine isn't a perfect match, and it doesn't stop transmission of meningitis B. So the NHS deemed it wasn't cost effective to offer it to teenagers. They're vaccinated at ages 13 and 14 against strains A, C, W and Y, but not strain B. And clearly that is a concern. Once they identify exactly what variant of strain B is responsible for this outbreak, if the vaccine is a match, we could see the vaccine offered to people in Kent, but we don't know that yet.
So, Nick, obviously you can get private vaccines for meningitis B, and people will be looking into that. Can you just explain to us how effective it is, how long it lasts? Because we know it's expensive.
It is expensive, several £100. As I say, it doesn't stop transmission. It will protect against serious illness if the vaccine is a match for this, this type of MenB that is circulating, and the authorities are still working to establish that. There's some evidence its protection does wane over time. The important thing at the moment is the antibiotics, and clearly lots of people have been offered antibiotics, as we see lots of people queuing up for that, and also to look out for people if they're ill, to keep an eye on them and to raise the alarm and respond quickly, because the important thing with invasive meningitis is to get treatment quickly.
The kind of buddy up system, which is really important. So if people are at university, we were hearing from experts saying yesterday, even if you're not feeling under the weather, if you're going to your room, tell a mate.
Absolutely. I mean, at university, students are living away from home, they're living in close proximity, and people may not necessarily spot, a fellow student is ill in their room and hasn't been seen for a day or so. So I think it's what the authorities are saying is do buddy up, do look out for each other. I think it's also important to say that meningitis does require, there's been a lot of talk about close contacts, it does require prolonged close contact. It's not like flu or measles, which really spreads very quickly. This doesn't spread as easily, and the close contact has to be really prolonged.